Hello everyone. I'm here to discuss about the recent initiatives in digital health. Since digital health is a vast topic, I like to restrict myself to the public health context and more focused on recent advances. My presentation will be more focused towards recent digital and health initiatives in our country and the innovations in the other countries as well, from where we can learn and think in the direction of adapting it to our Indian settings. First, I'll start with introducing the topic. Then, why did I choose this topic? I'll be providing the justification for it. Then, I'll be explaining about the various category of digital health products and services. I'll enlist the pros and cons, and I will conclude with it. So, what is digital health in first place? Digital health refers to use of information and communication technologies in medicine and other health profession to manage illnesses and health risks and to promote wellness. What are the objectives of digital health? The first objective of digital health is to improve the quality of outcome of care and services. The second objective is to address the disparities and to improve the population health. And the final objective is to improve the experience of not only patients but also the physicians and other healthcare workers. So, why did I choose this topic? Because digital health is gaining momentum owing to its ability to improve the access to healthcare, to reduce any inefficiency in the healthcare system, to improve the quality of data, to lower the cost of healthcare, and to provide more personalized healthcare to the patients. Here we can see how much money goes into digital health. Just in the year of 2022 alone, roughly 2.5 lakh crores were raised by digital health companies across the globe. And we can see hundreds of companies invest in different domains of digital health, like the AI, digital health devices, health management, virtual reality, digital therapeutics, robotics, all these. This shows so much significance is being given to digital health these days. Understanding the importance, our government also is very keen in prioritizing the digital health, and we have published more than 1,000 research papers related to digital health in India alone in the recent 4 years. Even our department promotes research in this field, and we have been involved in many digital health related projects. So these are the 50 top emerging digital service trends in the last year. And this is not a complete list of technologies that emerged last year. However, we'll try to restrict our discussion to digital health technologies which are more relevant to public health. And before that, we'll try to fit all these technologies under few broad categories. So, the categories of digital health products and services include telemedicine, mHealth, electronic health records, wearable technology, artificial intelligence and machine learning, health chatbots, remote patient monitoring, 3D printing, virtual reality, and augmented reality. First, we will see about telemedicine. What is telemedicine? That is nothing but a video or phone call appointment between a patient and a healthcare worker, which is very convenient modality gaining a lot of popularity in recent days, especially in the COVID and post-COVID era, where it saves a lot of time, a lot of money, and the risk of infection is being cut down. In India, we have adapted this telemedicine under the e-Sanjeevani initiative, where more than 10 crore teleconsultations are being completed. Earlier, we started with the eSanjeevani in 2019 as a doctor-to-doctor telemedicine system. In 2020, it has been extended to eSanjeevani OPD, where people can enjoy OPD consultations sitting from their home. Similarly, Telemanas is a comprehensive mental health care service launched in October 2022. Anyone can dial the helpline number given in the website and get in touch with a counselor. So these are the major telemedicine initiatives in India. What can be the next step? There is a concept known as asynchronous telemedicine gaining popularity in the Western countries. It is also known as store and forward telehealth since data is captured locally, then temporarily stored for transfer at a later time. The consulting provider then reviews the stored data and makes diagnosis, treatment, and planning recommendations that are electronically transferred to the referring provider. But how is this beneficial? It is beneficial because it is time saving. Since online forms streamline the patient intake and follow-up processes by storing patient data for later use. Using standardized intake questions and follow-up procedures, it makes the data collection more consistent for each patient, regardless of which provider is delivering care. Online forms help collect the same data points for each patient, storing them all in the same place. Other advantage of asynchronous telemedicine is the flexibility. Since no scheduling is involved, providers can complete online visits when it fits in their scheduling, such as in between in-office visits, during lunch or after hours. It is also efficient because intaking, diagnosing, prescribing, and charting for a patient encountered in the office for a patient encounter in the office or on a video call can take at least 30 minutes based on the complexity of the patient. Automated patient intake through online forms or remote devices in asynchronous telemedicine takes an average of only 3 to 5 minutes. Thus, it is a very, very efficient method. You might ask, already we are doing this. My relatives are sending me photos in WhatsApp, reports in WhatsApp. How does it differ from asynchronous telemedicine? Yes, again, it is a form of asynchronous telemedicine, but it is not standardized. Okay, because unlike what we currently follow, which is not a streamlined method, this asynchronous medicine focuses on usage of automated patient intake through online forms so that no data is missed about the patient. Next, we'll see about mHealth. What is mHealth? Medical and public health practice supported by mobile devices such as mobile phones, patient monitoring devices, personal digital assistants, and other wireless devices is known as mHealth. To put in simple terms, the usage of mobile and wireless devices to improve the health outcomes, healthcare services, and health research is called mHealth. This mHealth technologies and LMICs like India, that is low and middle income countries like India, have received increased attention for the significant potential benefits they can bring to the undeserved and unaccessible population. As smartphones are becoming increasingly accessible, many stakeholders in mHealth space have begun exploring smartphone application as a mean to impact individuals living within the LMICs. With the COVID-19 pandemic straining the healthcare systems around the world, many governments in the LMICs turned to use smartphone application to help support and manage their pandemic responses. India's government, through the National Informatics Center under the Ministry of Electronics and Information Technology, created a national COVID-19 application called Arogya Setu, which initially had four major functions. First is COVID-19 risk assessment. Second is symptom-based likelihood of COVID-19 diagnosis. Third is exposure tracking and notification. And fourth one is information dissemination. Later, this app facilitated scheduling appointment for COVID vaccination and for downloading the vaccination certificate. Now, Arogya Setu has become a one-stop solution and has become the national health app. It can be used for generating ABA ID, which is Ayushman Bharat Health Account IDs, and leverage it for interaction with healthcare providers, allows us to receive the digital lab reports and digital prescriptions. We can even use it for teleconsultations also. The National Health Authority under Ayushman Bharat Digital Mission has introduced Ayushman Bharat Health Account mobile application, which is mainly useful for creating ABA address and utilizing it to make people utilize the benefits of government programs. It is useful for management of health records and for discovering the health facilities which are available nearby. One more innovative feature of this app is that it has the facility for OPD registration using QR code scanning, which enables the patients to avoid queues in the hospital. Our government has also taken many such initiatives in mHealth, like the Kilkari app, which delivers pre-recorded audio health information messages weekly to the pregnant and postpartum women. Has another initiative called Mobile Kunji, which is an audio-visual job aid to help Ashas communicate with community members. Ashas use a deck of 40 color-coded cards with illustration and access supporting audio by dialing into an IVR service. Mobile Kunji helps standardize the frontline workers' delivery of the key messages, reducing inconsistency and significantly improving the interpersonal communication. Though this is not a new initiative, it was it was like 1 decade ago, initiated 1 decade ago. I just added this in this presentation since it shows that mHealth should need not necessarily involve high-end Android or Apple phones and 5G networks. A similar initiative launched recently in Africa is called Babel. Here, a registered patient sends a SMS code to arrange an appointment, and a doctor calls the patient mobile phone at the arranged time. The patient's local pharmacy or healthcare facility will dispense the prescribed medicine or conduct lab tests in line with the further SMS codes sent via this Babel. Again, this example was given to reiterate that mHealth need not always be based on high-end devices and 5G networks. So, what is the future of mHealth? In this slide, I'll show a few recent innovations in mHealth which can potentially be adopted to the Indian healthcare system in upcoming days. Many advances are made using vocal biomarkers. What is vocal biomarker? It is a feature or a combination of features from the audio signal of the voice that is associated with the clinical outcome and can be used to monitor patients, diagnose a condition, or grade the severity or the stages of a disease or for drug development. Many projects are upcoming which shows the use of voice for predicting vocal cord cancer, for predicting Parkinsonism, for predicting depression or anxiety, and even predicting the congestive cardiac failure. Another app known as Skin Vision is developed to remotely evaluate the suspicious skin lesions. Users can take a picture of the lesion in question, upload it to the app, fill out a short questionnaire, and will receive a preliminary evaluation prepared by the AI algorithm in a few minutes. This preliminary diagnosis will be followed by a final evaluation conducted by a human dermatologist in 1 to 2 days. What is the next mHealth initiative? It is called as UScan. UScan is a pebble-shaped device that dangles by a toilet bowl to scan the user's urine for biomarkers and to assess the status of hydration and vitamin levels. UScan's chemical analysis of urine is connected to a smartphone app that offers suggestions like the workouts, dietary changes, and the food recipes which they should take based on the results. Another app by Neurologics, known as the Anura, is recently launched, which demonstrates the usefulness of a selfie, which can be used for checking the vitals using a simple cell phone camera. This app uses artificial intelligence to offer about 1,000 diagnostics with a 30-second selfie. Diagnostics include heart rate, blood pressure, stress level, blood sugar levels, and much more. Another initiative in mHealth is called Hemochrome. It is a simple mobile health app that non-invasively measures the blood hemoglobin using a digital photo or screenshot taken with the everyday smartphone or computer, making blood hemoglobin testing accessible to nearly everyone anywhere at a fraction of cost. When these kind of devices are successfully introduced into the market, it can readily be adopted to our Indian settings because one of the six interventions of anemia mukbal is to test anemia using digital methods. Thus, the public health impact of such devices is going to be huge. The next initiative related to health is the PAHOLA. PAHOLA is the Pan
Hello, Paula.
Health
Buenos
Organization,
días.
new
Bom
to the
dia.
Indian health
Hola.
system alcohol.
Oi.
Buenos dias.
Oi.
É um prazer te conhecer. O que você gostaria de falar hoje?
Beber álcool pode causar câncer?
Há uma forte ligação entre o álcool e as doenças crônicas, particularmente o câncer.
How can I make sure I drink responsibly?
I'm sorry to say, but there's no such thing as responsible drinking.
¿Cómo sé si estoy bebiendo demasiado?
Puedo ayudarte a evaluar si lo que bebes puede causarte daños.
Hi, I'm Paula. I'm the Pan American Health Organization's first digital health specialist on alcohol use. I was built to provide reliable information about the impact alcohol can have on your health. I can also help you check if your drinking is putting your health at risk and guide you through a plan to cut back. Do you think you could benefit from drinking less?
I know I would. Can you please help me?
I'd love to help you. And I promise I won't judge. I'm a digital person after all. I don't know how to judge.
You can see how this Pan American Health Organization's digital health specialist on alcohol use, called PAHOLA, is helping the patients to make healthier decisions related to alcohol consumption. Like this, many apps are being developed targeting specific disease groups. The next digital health product which we are going to discuss is the electronic health record. What is electronic health record? It is an electronic version of a patient's medical history that is maintained by the provider over time and may include all of the key administrative clinical data relevant to that person's care under a particular provider. India has already started working in this field of creating electronic health record. Ayushman Bharat Digital Mission envisages an integrated healthcare platform for India, and the mission tries to digitalize the health records. Great numbers are already achieved where 23 crore health records are digitized, 33 crore ABA IDs are created, and 2 lakh health facilities are registered. As an attempt to boost digitalization of health records, government is even promoting the usage of DigiLockers to store health reports. What can be done further to improve digitization of health records in India? We have a great scope of introducing a digital scribe in India, where India is a country with high patient load and doctors are running short of time. This digital scribe has the potential to improve the quality of patient care and reduce the burnout amongst healthcare workers. How this will work? It will simply record a conversation between a patient and doctor. It will convert into text and it will be processed by AI to give an exact summarization, and the medical notes will be prepared by the AI itself. Recently, a private company known as Augmented has come up with a digital scribe. The company claims to save 3 hours per day for a healthcare worker, which significantly improves productivity and satisfaction of doctors and patients. One step ahead, they have introduced a feature called chart prep that prepares a patient's note and content for a physician to review based on the previous data. This again saves a lot of time for both the patient and doctors. If such new technologies in electronic health records is adopted by our government, it will be a huge leap in public health. Next, we are going to see about wearable technology. What is wearable technology? It is any kind of electronic device designed to be worn on the user's body. Such device tends to have processing or communication capabilities, and usage of such devices are on the rise. Like many of us do, usage of smartwatches are gradually increasing, and every day we get news that a new player has entered the field of wearable technology. With improved accuracy or with some new feature, we get new devices every single day. Just like this Samsung watch, which was launched before 15 days, which tracks the menstrual cycle based on the temperature. Healthcare companies the Movano has introduced a new smart ring, EV. EV is specifically designed to give women a full picture of her health, including resting heart rate, period and ovulation tracking, sleep changes, SpO2 levels, skin temperature variability, and much more. We have started getting wireless wearable glucose sensor as well. Here you can see this is the coin-sized glucose sensor, which helps in monitoring the patient's blood glucose levels and even alerts you when there is increased blood glucose level. We can expect that these kind of wearable sensors will be a great boon in the management of NCDs, which is a growing concern in recent days. And interestingly, insurance companies in few countries are looking into the possibility of deciding health insurance premiums based on your healthy practices. For example, if you're walking 10,000 steps per day, then your annual premium is 20,000 rupees. And if you're walking only 1,000 steps per day, then your annual premium is 50,000 rupees. Like this, these kind of initiatives can be taken in the near future, which will eventually promote adoption of better and healthy lifestyle, which will be a game changer and prevention and management of NCDs. Similarly, we have wearable devices to restore arm function in ALS patients and technologies which will help the ALS patients to communicate just by their thoughts. Recently, engineers at the University of California, San Diego have developed a wearable ultrasound system for cardiac imaging. This stamp-sized patch can be worn on the skin of the chest, and it uses AI and ultrasound waves to perform advanced imaging of the heart. The technology can even be worn to perform cardiac ultrasound imaging during exercise. Though there are hundreds of wearable technologies, the reason for showing these 4 5 new innovations is that All these are introduced in a short span of past 2 months. That is the magnitude and rapidity with which this field is evolving. However, wearable technologies are used mostly for personal fitness tracking and not widely considered for clinical decision making or in routine clinical management. So again, we have a great scope to introduce such wearable technologies in our country and work on improving their diagnostic accuracy, efficiency, and utility in public health. Next, we'll talk about the most talked after topic, which is artificial intelligence. So, what is artificial intelligence? It is a science and engineering of making intelligent machines or computer programs. It is related to the similar task of using computers to understand human intelligence. But AI does not have to confine itself to methods that are biologically observable. We often get confused between the term artificial intelligence and machine learning. What are the key differences? Artificial intelligence is a technology which enables a machine to simulate human behavior, whereas machine learning is a part of AI. It is a subset of AI which allows a machine to automatically learn from past data without extensive programming. The goal of AI is to make a smart computer system like humans to solve complex problems, whereas the goal of machine learning is to allow machines to learn from data so that they can give a accurate output. In AI, we make intelligent systems to perform any task like a human, whereas in machine learning, we teach the machines with data to perform a particular task and give a accurate result. So, how could AI be helpful in healthcare? Just giving a broad overview, when you give the patient's history, report of blood test, imaging, and other information, AI can process it and give us the diagnosis, treatment options, and prognosis. And this is the list of AI technologies approved by FDA. We can clearly see that AI can play a role in almost all fields of medicine with a greater scope in radiation and oncology. And the AI is a potential game changer in public health as well as new screening and diagnostic devices are introduced to common problems like the breast cancer. And it is not only happening in foreign countries, but such innovations are happening in India as well. For example, the NIRMAI, which is a breast cancer screening tool, uses thermal imaging to screen for breast cancer without intruding the privacy or touching the patient, and it has recently been FDA approved as well. This clearly cuts down the discomfort and radiation pain associated with the conventional mammography and has the potential to increase the acceptance for breast cancer screening. This is the wonder that AI can make in public health. During the start of this month, Spotify's founder has developed a AI-powered body health scanner. It is a 360-degree body scanner which comes equipped with over 70 sensors that collect more than 50 million data points on skin, heart, vessels, respiration, microcirculation, and much more. Ada is a health company based in Berlin that operates an end-user self-assessment app. It takes reported symptoms, matches them with symptoms of patient of similar age and gender, and reports the statistical likelihood that the patient has a certain condition. Next there is next talking about an app called Corti. Corti is a AI-powered
911,
co-pilot.
what is your emergency?
I need help. I need an ambulance. Hey, Dad, what happened? Dad?
Can you please verify your name and address and tell me what happened?
Yes, I'm Annie Robinson. We're at 1450 Bay Street, San Francisco. My dad was installing kitchen cabinets, and I think he knocked his head or something. I just heard a bump, and then he fell. I can't get him up, and he's not being responsive. Dad, are you okay? Oh my God, I think his head is bleeding. Oh my God.
All right, give me one moment. Okay, an ambulance has just been dispatched and it's on its way to you right now. They'll arrive in 4 minutes.
Okay.
And while we wait, can you tell me if your dad is conscious?
Yes, I think so. Actually, no, I'm not sure. I can't tell. His eyes are open, but his face looks all weird. I guess he's conscious. I don't know.
Okay, hold on. All right, we need to make sure that aside from hitting his head, there's nothing else wrong with your dad. Does he seem to be breathing properly?
No, actually, I don't think he's breathing right, but maybe he's just disoriented. I don't know.
Okay, Annie, This is important. He may be suffering a cardiac arrest. So if you're not sure, I'm going to walk you through how to check his breathing.
Oh my God. Oh my God, I thought he just fell and hit his head.
You can see
Is he
this
having a
Cotta
heart
is an
attack?
AI-powered
Then what
co-pilot
do I do?
for emergency medicine staff.
It's
By
okay,
listening in
you can
on
do
patient
this.
interviews,
Listen to me
analyzing
and
the
stay
caller's
calm.
voice and the
Can you make
background
sure that
noises,
he is lying
and
flat
taking
on the
insights
ground
from
and that he
historical
does not
data
have any
and
vomit
artificial
or
neural
food in his
networks,
mouth?
this AI
Okay,
is
yes.
able to understand
Hold
the
on. I'm
context
just gonna
and
put
the
you on speaker.
patterns
Hold
in
on one
critical
sec, okay?
conversations. In this way,
Okay.
it can
Okay, I'm
assist the
ready.
emergency medicine
No, there's
professionals
nothing
by
in his mouth.
alerting and making
Great.
life-saving decisions. It is estimated that in the next 5 years, AI can save up to $360 billion per year in healthcare. For example, in hospitals, the cost savings comes mostly from improved clinical operation, quality, and safety, like optimizing the operating rooms or detecting adverse events. The benefits are similar for physician groups, which could leverage AI for continuity of care, like the referral management. Health insurers would see savings from use cases that improve claims management, like automating prior authorization, along with healthcare and provider relationship management. Next, we'll see about ambient intelligence. Ambient intelligence means it is a technology supported environment that is sensitive and responsive to human presence, with the technology part remaining as close to invisible as possible. Here in this photo, you can see many sensors and cameras are fit in the room of an elderly patient. Sensors and AI-based fall detection and prevention solution in an elderly care facility is an example of ambient intelligence. The sensors and physical devices, such as cameras, are embedded in the environment, and the algorithm runs in the background, and it provides added value to the patient. If a patient is about to fall, it is going to alert the healthcare professionals and the caretakers. Similarly, when the patient has already fallen down, then again it informs the healthcare professionals and the caretakers so that appropriate action can be taken. Similar use cases include using AI to closely monitor patient mobilization in ICU, keeping track of proper compliance with hand hygiene protocol, usage inside OT to keep track of surgical instruments and gauze pieces. A count of these instruments and gauze pieces during surgeries can be assisted by ambient intelligence. So these are the use cases of ambient intelligence, which is an upcoming subfield of AI. Next is a very interesting thing, that is the emotional AI. Emotional AI is also called as affective computing and is about detecting emotions using artificial intelligence and interacting with humans in a way that suits their current emotional state. It can identify emotions by measuring micro expressions that are too fast and subtle for a human eye to capture. Emotional AI can monitor non-verbal cues in a remote healthcare appointment like the telemedicine and can give more information to the doctors. It can help autistic people to interpret others' feelings and thus improve their social skills. With emotion AI, the autistic people are able to better understand the emotional condition of those whom they are communicating with. It can also monitor the waiting patients in the OPD for signs of discomfort to determine one's need for urgent care. All these days, we were telling that machines can never replace the human touch. But with the advent of emotion AI, this statement might not hold true for a long time. Next, we will see about health chatbots. Medical chatbots or health chatbots are the AI-powered conversational solutions that help patients, insurance companies, and healthcare providers easily connect with each other. These bots can also play a critical role in making relevant healthcare information accessible to the right stakeholders at the right time. Florence is a digital worker of WHO. Through a series of interactive questions, Florence will provide guidance on stress management, how to eat right, how to be more active, how to quit tobacco and e-cigarettes, and which COVID vaccine to take, and much more. Similarly, We Bought Health is a mental health chatbot which is recently introduced. Talking about AIs and chatbot, how can I not talk about ChatGPT? ChatGPT is an artificial intelligence chatbot developed by OpenAI and launched in the year 2022. And ChatGPT is so intelligent that it has even cleared USMLE. But how it can be useful in public health? It can help us in summarizing medical records based on patients' family history, symptoms, and lab results. It can help in writing emails, letter to insurance companies, and other administrative tasks It can help in prevention or preparation of IEC materials, which can be used for the awareness generation among the community members. It can help in handling the appointments, and it is gradually being invading the space of research as well. And now Google has released its counterpart for ChatGPT this month. Even though they're not perfect tools at this moment, it is pretty evident that these AI-based chatbots are going to grow rapidly and help in exponential growth of healthcare in the near future. Next, we'll see about remote patient monitoring. What is remote patient monitoring? Remote patient monitoring is the use of connected electronic tools to record personal data and medical data in one location that is reviewed by a provider at a different location. How is this useful? Remote patient monitoring can be used to treat both acute and chronic conditions, enabling the clinicians to keep an eye on patients in between the clinic visits or when in person care is not possible. The concept of remote patient monitoring is gradually evolving over the past 2 decades, and we have a lot of research articles highlighting the benefits medically as well as non-medically, like overcoming the accessibility issues, transportation barriers, financial barriers, etc. And with the advent of new technologies like this camera reading your forehead to estimate your blood pressure, or this device which delivers the injectable drugs at the right rate at your home itself, uh, this remote patient monitoring looks promising. Remote patient monitoring is beneficial not only to the patients but also to the healthcare providers. That is why United Kingdom government is keen on expanding the remote patient monitoring and facilitating the functioning of virtual wards. This concept is slowly being introduced into our country as well, especially in the private setup, where a doctor remotely monitors a patient admitted in ward. In upcoming days, we can expect that this concept of virtual ward will be widely adopted in our country as well. Next aspect of digital health, which we are going to discuss, is 3D printing. What is 3D printing? It is the process of creating three-dimensional objects by layering materials such as plastic, metals, and even tissues. In recent years, 3D printing technology has made significant advances in healthcare and is being used in a variety of applications, like the prosthesis. 3D printing is being used to create customized prostheses for patients, especially the children who require a personalized fit. 3D printing enables the doctors to quickly create prosthetic limbs that are tailored to the patient's specific needs. Another utility of 3D printing is surgical planning. 3D printing is used to create models of the organs or body parts that need surgery. These models allow the surgeons to plan and practice complex surgeries in advance, which reduces the risk of complication and improves the surgical outcome. 3D printing is also useful in creating custom implants such as hip or knee replacement implants that fits perfectly into the patient's body. These implants are more comfortable and have a longer lifespan than the traditional implants. In an Indian Army hospital, rehabilitation of a young patient's skull defect using advanced 3D printing technology was done with the for titanium cranioplasty repair. 3D printing is also being used to create live tissues such as skins and cartilage, which can be used in tissue engineering to replace the damaged or diseased tissues. Yet another use case of 3D printing is the printing of medicine. We can print the medicine in whatever form and composition we want. For example, in the University of Santiago, the printing of pediatric medicines has started. Those medicines are chewable based on the weight and clinical characteristics of the patient. But how it is beneficial? It is beneficial because it avoids dosing errors compared to the traditional methods. It has improved acceptability, and we can even alter the taste of medicines based on the preference of the patient. And it can be printed in shapes of toys as well. Imagine the public health impact when we are going to give a sweet iron and folic acid or albendazole tablet to the children with a Shinchan or Dora Buji or superhero faces printed on it. We can start exploring in this direction to improve the drug compliances, especially for the management of diseases of public health importance. Overall, 3D printing has a potential to revolutionize healthcare by providing customized solutions that improve the patient outcomes and reduce the costs. The final digital health product or a service which we are going to see is virtual reality and augmented reality. Virtual reality is a computer generated environment that stimulates a realistic or imagined environment in which a user can interact with objects or other entities in a seemingly real or physical way. Whereas augmented reality is a technology that overlays digital information, images, or other virtual content onto the real world environment, enhancing or modifying the user's perception of reality. Unlike virtual reality, which creates a completely immersive digital world, augmented reality enhances the real world by adding virtual elements to it. Virtual reality technology has a growing range of applications in healthcare, providing new and innovative ways to diagnose, treat, and manage various medical conditions. Here are some examples. VR can be useful in immersive distraction that can help reduce pain and anxiety during medical procedures or during post-op periods or during deliveries. VR can also help in realistic and interactive stimulations for medical students and professionals to practice surgical procedures and other medical interventions. VR can provide exposure therapy for patients with anxiety disorders or phobias, allowing them to confront and overcome their fears in a controlled and safe environment. VR can provide a way for patients with Alzheimer's disease to revisit familiar environments from the past, improving their memory and overall well being. Coming to AR, which is augmented reality, AR can provide medical students and professionals with realistic and interactive stimulations to practice complex surgical procedures, anatomy, learn anatomy, and medical interventions. AR can enhance telemedicine consultations by allowing physicians to remotely visualize and manipulate patient data and images in real time, improving the diagnostic accuracy and treatment outcomes. AR can provide 3D visualization of medical imaging, such as CT scans and MRIs, allowing patients to better understand the patient's anatomy and plan surgical interventions. AR can provide fun and interactive way for patients to perform rehabilitation exercises and provide motor skills after an injury or surgery. AR can provide patients with visual representation of their medical conditions, treatments, and medications, enhancing their understanding and compliance with medical instructions. Overall, VR and AR technology is promising tool that can improve patient outcomes and quality of care in a range of healthcare settings. As discussed in the beginning of the presentation, the pros of digital health include improved access to healthcare, reduction in inefficiency in healthcare system, improvement of quality of care, lowering the cost of healthcare, and provide more personalized healthcare to the patients. The cons include hacking medical devices remotely. New medical devices and implants are increasingly getting wireless connectivity features. However, this also means that they are prone to hacks and these could prove fatal to patients. Back in 2011, a researcher showed that it was possible to hack Medtronic insulin pumps to deliver fatal doses of diabetic patients. Others can hijack pacemakers over Bluetooth, compromise X-ray data, remotely reconfigure CT scans to alter radiation exposure, and the list goes on. Privacy and security issue pertaining to the digital health era are complex and multifactorial. These aren't likely to get any simpler as more and more advanced technologies get integrated into this field. Next is the cybersecurity threat and ransomware attack on hospitals. We all are aware of similar incidents in AIIMS Delhi recently, when such an apex institute with very good IT infrastructure is prone for ransomware attack. It means that that attack can happen to any healthcare facility. Next is the technology supporting self-diagnosis. Physicians are worried because patients just Google their symptom, they Google that they have headache, then Google shows that they have brain tumor. Then they keep them the patient comes to the physician and directs the physician to order this investigation, that investigation, do surgeries, etc. So this technology supporting self-diagnosis by patient is a serious concern, which is a con of digital health. Next, bioterrorism through digital health technologies is a major concern. But the convenience and enhanced medical solutions brought about by the interconnected world of digital health technologies, bioterrorism also propels to new levels. We discussed how medical devices can be hacked remotely and that ransomware attacks hold the risk of being fatal for some patients. Uh, Even there is a comment from Elon Musk that he wants to embed a Fitbit in your skull, while startups like Nanotix is developing nano robots that mop up molecules that trigger diseases and aging from circulation. With such advanced technologies on the horizon, are we equipped to prevent bioterrorists from hacking into these devices to directly gain over our health? This is again a matter of concern. Next concern is the availability is health insurance. With the availability and adoption of fitness trackers and health sensors, health insurance companies are able to assess applicants for insurance coverage based on their individual needs. However, such availability of personal data is also a double-edged sword. Insurance companies could demand access to individuals' wearable data in order to offer insurance, charge higher premiums if customers aren't maintaining a healthy lifestyle, and even discriminate against applicants based on their genetic risk. Next is the fear of human rejection. Fears about AI eradicating humanity go hand in hand with exaggerated statements about AI coming from the AI for the jobs of medical professionals. Even Stephen Hawking said that the development of a full artificial intelligence could spell the end of human race. However, AI is said to take the jobs of radiologists and the skills of a surgeon. Uh, so these kind of fears has led to hesitancy amongst the healthcare professionals in order to adopt these new technologies. And we do have ethical challenges. Whom to blame if a smart algorithm makes a mistake and does not spot a cancerous nodule on X-ray? To whom could someone turn when AI comes with a false prediction? So all these ethical and legal questions need to be addressed. The final point is misconception and overhyping. Overhyping the ability of AI through marketing tactics and oversimplified media representation does not help but destroy a healthy image about how AI could contribute to healthcare. It also adds to the fog of confusion and misconceptions which need to be cleared up when we want to implement the technology successfully into our healthcare system. IT infrastructure to support digital health intervention is more frequently lacking at lower and mid-tier health facilities compared to apex facilities in India. Gaps were generally larger for staffing than physical infrastructure, suggesting that beyond IT infrastructure, shortages in essential staff who handles these IT infrastructure should be addressed so that this digital health innovations and interventions can be adopted appropriately. So to conclude, with diagnostic tools getting more compact, connected, and patients having access to them, it is evident that advanced technologies will play a central role and virtually any medical specialty. No physician will be able to work without these digital health technologies in the near future. Even with the reliance on technologies in the future of medical professions, the human factor will equally play a major role. This is because those technologies will essentially take away the repetitive components of the job and subsequently free up valuable time for medical professionals. As such, advanced technologies take over, they will allow the physicians to deal with patients more. Doctors will thus need to show more empathy and compassion when communicating with the patients. Their lack of soft skills might become more apparent than what is being the scenario today. A question that often comes to our mind is whether advanced technologies and automation in medicine will take over the medical profession altogether. Such concerns might make the specialist skeptical about adopting to new technologies. But even in a specialty like radiology, automation will handle most of the many repetitive and data-based components. It will still require the input of human professionals as they will be better equipped to handle creative challenges. Rather than competition, technology should be seen as a cooperation that amplifies the human performance. For India to fully tap the potential of digital health revolution, significant investment to boost digital infrastructure is the need of the hour. As technologies are changing the healthcare, it also empowers the patient to have their voices heard as they will become more proactive in managing their own healthcare. That is, we'll be moving towards patient-centered healthcare. So we can expect that in near future, public health will be revolutionized by the advent of digital health. Let us not only witness it, but we shall also try to actively contribute towards it. These are my references. Thank you.